Thank you all and welcome for joining us tonight and being in the space this evening. I will be running through what this evening will look like for all of us. And thank you again for all of our wonderful panelists, our co-hosts for making this possible. We'll do a quick round of co-host introductions. That's including the Contra Costa Budget Justice Coalition. That's myself, Ensuring Opportunity, MFAC, and also Roots and Bloom, which is Rachel Rosekind. We'll do a speaker introductions as well, and then we will go into our moderated panel discussion that will be led by Mariana Moore, and then we will end with an audience Q&A. And so you will have time to, place your questions in the chat, and then we will, hopefully have the time to answer as many as we can. And the next slide, please. So I'll quickly introduce myself with the Contra Costa Budget Justice Coalition and what we really hope to accomplish in this space is we build shared community knowledge and power in the county's budgeting process, serving as an accountability anchor while centering and uplifting the voices of those most impacted, particularly communities of color and low-income residents in Contra Costa County. As a program manager, I aim to advance equity-driven practices to address systemic disparities, and of course, grounded in my belief that community voices must be central to decision-making. Thank you all for being here tonight, and I will pass it over to Greg.
Yeah, I'm Greg Colley with the Multi-Faith Action Coalition. I also want to welcome everybody. We're a coalition of residents, faith communities, and advocates taking action together in support of our most vulnerable neighbors. That includes advocating for policies that will help reduce poverty. That's our focus. And of course, tonight's subject is exactly that. Thanks again very much. And I'll turn it over to who's next.
And that would be me. Good evening, everyone. I'm Mariana Moore, the Senior Director and Co-Founder for the Ensuring Opportunity campaign. We've been in Contra Costa for about 11 years, and we bring together, as it says here, advocates and residents and humans and organizations and system leaders and labor and all kinds of folks together to talk about and work to solve all kinds of issues related to the root causes of poverty in Contra Costa. And I see so many familiar faces and lots of new ones, and we're glad you're here. And to kick us off, I'm going to turn it over to Rachel, and I'm going to remind myself, because I just failed, to speak more slowly. Apologies to our interpreters. So I will ask all of our speakers to come to model and do better than I did just there. Sorry about that. And Rachel Rosekind, welcome.
Thank you. So I'm Rachel Rosekind. I work at the nexus of racial and economic justice to foster greater access to life-affirming resources and opportunities for marginalized populations. I partner with Budget Justice Coalition and Ensuring Opportunity on numerous initiatives, and I'm delighted to be collaborating with the Multi-Faith Action Coalition on this event. Next slide, please. So Measure B will appear on the June 2nd ballot as follows. We're here tonight to help Contra Costa County address cuts in federal funding, support local services such as healthcare, supplemental food assistance, and other general county services. Shall Contra Costa County adopt a 5/8 of 1 cent temporary general sales tax for 5 years, providing an estimated $150 million annually and subject to annual audits? I have a dog barking in the background unexpectedly. I just need to
I don't think you advanced the slide.
I'm not advancing the slides. I'm not in charge of advancing the slides.
I think you just may have to mention that so they can do it. Okay.
Okay. Next slide, please. H.R. 1, also known as the One Big Beautiful Bill Act, was signed into law on July 4th, 2025. Its impact will be felt for decades to come. Most significantly, it slashes $1 trillion in healthcare and $187 billion in food assistance and gives the wealthy $1.4 trillion in tax cuts. These funding cuts will cost California billions of dollars over the next 10 years, and the state has already taken drastic action in response, such as freezing new Medi-Cal enrollment for undocumented adults. Not only does this legislation amplify a broken tax system that enriches the few at the expense of the many, these cuts place critical safety net services and the people who rely on them in mortal danger. As these impacts phase in, counties will be burdened with much higher administrative costs and subjected to increased fiscal strain, and yet they are severely limited in how they can raise revenues. While our county hospital and community clinics face major funding and service disruptions, many other county workers are on the front lines, implementing and training staff on new screening, exemption, and renewal guidelines for Medi-Cal and CalFRET. Next slide, please. Reduced federal funding for public benefits and administration and tightened eligibility, renewals, and work requirements will mean significant loss of revenue to our public systems. Our speakers will certainly share more details on this. These new unfunded mandates will mean higher administrative workload alongside reduced reimbursement for services. The county is required by law to provide care for people with no other option, and our public hospital will have to absorb the costs of uncompensated care. So those are the impacts on the system side, but our systems exist to serve people for whom the county's safety net is an irreplaceable lifeline and who are the reason we've gathered this evening. Next slide, please. In 2025, 432,782 residents, almost 40%, were served through the county's public benefits programs. These supports help families bridge the gap between what many jobs pay and what it actually costs to live. Keeping people enrolled in benefits is not just an ethical imperative, it is a social good. Safety net benefits protect and promote public health by increasing access to preventive and routine care and ensuring that emergency services are not a substitute for them. They also yield long-term gains for individuals and communities, including decreased poverty and food insecurity, healthier brain development in children, increased academic success, and cost savings on criminal justice, healthcare, and other social services. It's worth noting that the estimated economic payoffs of children's programs have been found to be greatest for those addressing health, like Medicaid. Next slide, please. The acute harms resulting from these changes will affect many residents who are already struggling, including systems-involved individuals, such as formerly incarcerated people and foster youth, immigrants, seniors, people with disabilities, low-income residents, and people of color, leaving them exposed to delayed care, increased hardship, and risk of medical debt, a leading driver of homelessness. 93,000 people in Contra Costa are at risk of losing health insurance, and up to 17,600 may lose food assistance. New work requirements jeopardize the continuity of safety net services for those who need it most. Work requirements are already part of several safety net programs, and research has consistently shown that they do not increase employment opportunities in the long run or decrease program dependence, but rather these policies lead to participants being pushed out of programs. To be clear, these changes will impact all of us. Over time, losing access to coverage not only harms individual health, but leads to overcrowded clinics, longer wait times for appointments, and fewer resources for providers to serve their communities. It may also trigger higher health insurance premiums and overall service reductions. Next slide, please. The programs most under pressure, healthcare access, housing support, food assistance, have propelled us toward a humanitarian crisis. As a result, more residents will turn to county services as fewer qualify for federal and state assistance. And loss of access to care and basic needs support will only amplify the serious disparities in health and well-being that already exist across our county. Next slide, please. Given these dire straits, the county has proposed a pathway to navigate them. Measure B is a general sales tax, meaning it can be used for multiple purposes. But county leaders have stated that its intent is to protect and sustain our county's healthcare system, help keep eligible residents on Medi-Cal and CalFresh, partially fill the federal and state funding gap, and proactively increase revenue for the significant fiscal pressures to come. Next slide, please. In the months since the measure was approved, residents have expressed concern about lack of clarity over how funds will be spent, understanding how different community needs will be prioritized, absence of community engagement, transparency, and oversight, and another regressive tax on the heels of Measure X and amid a rising affordability crisis. Our questions for tonight's panelists touch on all these issues. Next slide, please. So tonight we will be able to hear directly from county leaders how federal and state cuts will impact residents and safety net services. We'll engage in shared learning and discussion about how this tax measure aims to mitigate the impact of those cuts. We'll hear from proponents of Measure B about its intent, parameters, and accountability. And then, of course, we will allow time for community members to pose questions to our panelists. And before we move into our panel, we first are going to welcome our guest speaker, who is Dr. Grant Colfax. Dr. Colfax is CEO of Contra Costa Health, an integrated county health system that includes a 167-bed hospital, 10 outpatient clinics, behavioral health services, public health programs, and a 275,000 member health plan. He has more than 2 decades of leadership experience transforming and strengthening healthcare organizations, and he will give us a deeper dive into how this landscape will affect our county and its residents. Thank you, Dr. Colfax.
Well, thank you so much, Rachel, and really here to provide information around the impacts of the state changes in HR1 on our healthcare system. And sorry, I'm just wanted to make sure. Can you all see me okay? Because my screen's still showing the speakers.
I can see you and
Okay.
the meet our speaker slide.
And
Okay.
Trinity, maybe take down this slide here so we can see Dr. Colfax more fully and he can see our community. And then we can put him
That's
back
great.
up.
Thank you. All right, great. So I'm here to share data with regard to the effects of the state changes in HR1 on our healthcare system. And Rachel went over some top lines, but I just want to provide a little more context. So because of state changes in HR1, thousands of people in Contra Costa County and millions of people across the country are at serious risk of losing their healthcare coverage. In this case, in our case, and in the state's case, Medi-Cal, because of changes in eligibility requirements. So in Contra Costa County alone, over 90,000 people are at risk for losing their coverage over the next few years. So just for some context, we've had a big drop in the uninsured rate in Contra Costa County because of the implementation of the Affordable Care Act, also known as Obamacare. The state changes and HR1 changes will reverse a large amount of that progress because of the changes required by law with regard to how people enroll in Medi-Cal, what the requirements are to stay in Medi-Cal, what the verification requirements are, and so forth. So this is really serious, and this is the first time in decades where we are risking seeing people lose their public insurance coverage rather than gain their public insurance coverage. The second big component is the fact that because of these changes, within our hospital and clinic system alone, we estimate that through fiscal year of 2031, that we will be having $500 million worth of cuts due to the state and federal changes. $500 million in our clinic and our hospital system alone. And if we take into account increasing medical and other costs of the county at a conservative estimate of just 3% a year, if we add that 3% increasing cost figure over the 5 years and include that 500 million, we estimate that our hospital and clinic system will be about $1 billion in debt by 2031. So if and when these changes go fully into effect, our healthcare landscape will be radically different from what it looks like now. And I think the other key component is that within that $500 million in reduction, there's a component where we'll lose resources because of people being uninsured, and then there's severe funding reductions to the federal resources that hospitals currently receive to provide care for people who are either uninsured or underinsured or in Medi-Cal. And then I think the other big component here is when I'm talking about these costs, they do not include the cost of unreimbursed care for people who have no coverage, right? So if people lose their healthcare coverage, our hospitals, and this includes our county hospital, but also includes other hospitals across the country, are required to care for people, right? We don't turn people away. We can't turn people away. And so that becomes increasingly costly as healthcare systems are asked to carry more cost of caring for people who don't have any coverage, and therefore the healthcare systems cannot get reimbursed for caring for those people. So this is a serious situation for us in terms of our ability to carry out our mission to care for all in Contra Costa County, including and especially those who are most vulnerable. And this is going to affect people across the county, whether or not they currently have Medi-Cal, right? So as we see people lose their coverage, as we anticipate people losing their coverage, that means that people aren't going to go for primary care, right? That means they're not going to go see their nurse practitioner or their physician for care. And we know when that happens, people end up in the emergency room sicker. And being sicker in the emergency room means that people have to be cared for in the emergency room, which means the emergency rooms fill up, right? So we anticipate across the county, across our hospitals, that there will be longer wait times. There will be sicker people. And unfortunately, because they're not getting the primary care they need, people will be sicker and may die sooner as a result of that lack of care. I'm a primary care physician myself, and when I trained, there was no Affordable Care Act or Obamacare, and I personally experienced in the emergency room in a county hospital seeing people who walked into the emergency room with end-stage colon cancer, end-stage breast cancer, a whole host of illnesses that unfortunately were sometimes terminal because they hadn't gotten the proper prevention, screening, and care. So from a individual perspective, from a community perspective, and from a public health perspective, there are real challenges ahead. And I'm happy to answer any questions with regard to the data I just presented.
Thank you, Dr. Colfax. Appreciate that very lucid overview of all the challenges facing you and the system you lead and the communities that you serve. We're now going to open it up for questions. Just want to remind folks that Dr. Colfax is the county employee who leads this system. He's not part of the sort of political structure in Contra Costa. So I think the most um, appropriate or helpful questions to ask him might be about clarifying the data that he shared and the impact that will happen in this county. And then later in the broader panelist discussion, we will talk about some of the questions around how the funds could be invested and what that decision-making process is like, et cetera, et cetera. So just want to offer that clarification. All right, I see Michelle Hayes. Welcome.
Hello, and thank you for that overview. Um, I guess it's just such a sad situation, but I guess my question will probably be needed at, for another guest speaker regarding the funds. So after getting its attack, you know, do we have enough money to cover some things before we actually have the money from the sales tax? It seems dismal. There's going to be a gap in there somewhere. So, because things are happening right now as far as people's health coverage. So I'm just trying to process, what can be done as far as if there's no money right now, and I don't know if Measure B passed and the collecting of that won't happen from some years down the way. So what are we going to do in the meantime? Anyway, that's just a question.
Dr. Colfax, are you ready to answer that question?
I'm here to provide the data on HR1 and the state reductions in my official capacity.
Is what you're saying then that you think that other panelists can more ably answer or more appropriately answer the question? Is that your request?
Yeah, I'm not here to be able to answer those questions.
Okay.
Thank you.
Yeah, thank you. So again, ask our audience members, and I know it can be hard to sort it out, but we'd ask folks to focus on technical questions around the funding cuts and the impact on the hospital system. And I know that can be confusing, so no worries. We'll figure it out together. We'll go on next to Roxanne Carrillo Garza. Welcome.
Thank you. Yeah, I just had a question about, you mentioned that the cuts that you were projecting for the health department don't include folks that might be served by the county's indigent program. But I guess this is also partially a question for the people that are proposing Measure B. But I mean, would it be technically available for you to use, if Measure B were to pass, to use some of that money for that indigent program? I asked this because, I was just on a call earlier today, and LA is doing a similar measure and is including everyone in terms of how they will use the money for healthcare. So just wondered if that was any part of the thinking so far.
I think I refer to the comment in the chat. I can't answer that question in this capacity. I'm sorry.
I think we'll answer that, Roxanne. We'll be able to answer those questions.
Okay, thanks.
Yeah, and I see that folks are struggling a bit with the delineation, and we apologize. It's just as a county employee, Dr. Colfax is constrained in what he can say and answer some of the questions that might be more subjective or more decisions that are at the level of the Board of Supervisors, and that level of leadership in the county. So if folks have questions more around, as we said, the cuts themselves and the impact on the system, that's the area that Dr. Colfax is best able to address. I'm going to go on, and Supervisor Gioia and others in the discussion to come will talk all about that. So questions will be answered, and please hang in there. And thanks for asking them. Leon Kennedy, you're next. Welcome.
Hi, good afternoon, Dr. Grant. I do want to actually highlight and thank you for presenting the data as well as presenting the challenges we face as community members. I am Leon Kennedy from the local Contra Costa Youth Action Board. I did want to ask at this time with the presented data, how do we create awareness for our community members that will be impacted to know any possibilities to counteract or be able to find other resources at this time?
So I think that, we're working with many organizations and also with our sister department, EHSD, to ensure that people understand the importance of staying on Medi-Cal, and doing everything possible that to meet people where they are and provide the opportunities for people to sign up and to stay covered. And we provide the care to people who have Medi-Cal. EHSD is in charge of determining eligibility and renewing those applications, but we're really working with the support of the Board of Supervisors to make sure that people understand the importance of signing up. And as things change, and potentially become more disruptive, that there's help available there. That's really one of the key priorities that we've been working on to ensure that of those over 90,000 people who are at risk for losing their coverage, that if they remain eligible for coverage, that they know how to sign up and renew if they need to renew.
Understood. Thank you, Dr. Grant. And we have seen the rise in emergency services recently, so I'm in hopes we can shift this curve or turn it around. Thank you so much.
All right, thank you, Leon, for that question. We have two more questions. We're gonna stop it at that point, because we don't all have a million questions, but because we need to move on to our full panel. So Debbie Toth, you're up next. Welcome.
Thank you, Mariana. Hi, Dr. Colfax. So I apologize if I missed this in the presentation. I was driving and switched to my laptop and may have missed it. But one of the things that I think the average community member may not consider is not just that people are receiving their primary care in the emergency department and that folks are coming in later and later in their care needs, as you mentioned, but what happens to the people who go there for an emergency who are regular? They're not on Medi-Cal, they have a commercial plan, they go to the emergency department because they have an urgent emergency and the emergency department is full of primary care visits. Like, how does this impact when we don't have the funding to cover that? So if Measure B didn't pass, what would it look like for other people who aren't necessarily impacted by the loss of Medi-Cal?
I think with the changes that we're seeing and up to over 90,000 people at risk for losing Medi-Cal, that there will be, I mean, if we look at the data, when people are uninsured, they go to the emergency room for their care, sometimes very late in stages of their disease, but also, as you point out, for their primary care. And I think the bottom line is these changes are going to affect many people across healthcare systems. So this is certainly going to affect the county healthcare system, but by extension of people losing care and having emergency rooms more crowded, it's going to create potential delays in care for people going into emergency rooms that are not necessarily part of our system, right? So whether you're covered by Kaiser or Sutter or a John Muir patient, we would anticipate emergency rooms becoming very crowded and potential delays in care. And unfortunately, people coming to the emergency rooms either sicker or people coming for things that would normally not be appropriate for an emergency room, but they don't have a primary care provider who can help them. And therefore, if you're one of those people who really needs the emergency care, and there's a bunch of people in the emergency room, with needs that might not be as serious as yours, there could be delays in that care. So I think the bottom line is, we just step back for a moment. This is going to affect people across Contra Costa County, whether they they're enrolled in Medi-Cal, whether they have family members enrolled in Medi-Cal, or whether they have private health care, right? It's going to have, we believe, a very strong effect across our healthcare systems, not just for people who have Medi-Cal or their families. Did
Thank
that
you.
answer your question? Thank you
It
for.
absolutely did. Yeah, I just think that people think, oh, if I'm not on Medi-Cal, this is not going to impact me. And it's really important for us to, not everybody has Mariana and Rachel's heart. Not everybody is like, one of us is not okay, so all of us are not okay. But the average person, regardless of whether or not they are Medi-Cal, are going to be impacted by this if we don't pass this measure. I mean, they're going to be impacted if we do pass the measure, but it's going to be far worse if we don't. I guess I just wanted to make that point and confirm that I'm accurate. Thank you.
All right, thank you, Debbie. Our last question, Jim Donnelly, go ahead. and then we'll have 2 questions in the chat, and then Dr. Colfax will
Okay.
let you go.
Just real quick, the numbers, Dr. Kovacs, thank you for the presentation. The numbers you presented as far as the impact, I'm curious, does that include the additional cost for eligibility workers? Because I saw in EHSD's budget, they need a whole lot, like 46 more eligibility workers. So is that already accounted in your numbers, or is that separate?
The numbers I presented are the numbers we presented to the board specific to the hospital and clinic system.
Okay.
They did not include EHSD estimates.
Which is another big hit.
Yeah, we don't have those included in the numbers.
Okay. Yeah, thank you. But we all need to be aware, what's happening here, it's affecting more than just the hospital. It's gonna affect other agencies too in the county. So thank you.
Yeah, thank you, Jim, and thank you, Dr. Colfax. EHSD is Employment and Human Services Department, which is the county's social service department, which many of us know and some of us may not, and that's fine. All right, the first question from the chat. Question for Dr. Colfax. Do we know who the people are who would lose coverage? That's the question from Greg. So who would lose coverage?
Yeah, so in general, it would be people there the people who are at most risk are people who are who received expanded coverage under the Affordable Care Act or Obamacare. So in general, that would be the group of people who would be at most risk. And then because of the state changes, people who are defined by the state as having unsatisfactory immigration status, that's the term that's used by the state. People who have that status as of January 1st of this year who are not previously enrolled in Medi-Cal are no longer eligible for Medi-Cal. So again, EHSD, the Department of Employment and Human Services, that's the department that's the experts on eligibility, but that's in general how I think about it. So it's the people who were able to get Medi-Cal coverage as a result of Obamacare and the Affordable Care Act, and then people who were initially just recently able to get Medi-Cal coverage because of the state's expansion to people of unsatisfactory immigration status that as of January 1st has stopped for people who will be newly enrolling.
Great. Thank you, Dr. Colfax. And the last question for you from chat, and it may or may not be one that it was within your purview, but I'll ask it in case it is. The question from Joanna is, will the cuts mostly impact personnel or health programs within Contra Costa Health?
Well, I think, given what I just talked about the reductions in our funding, and I would encourage people to go to the budget hearing at the Board of Supervisors last week, where there are a lot of things that we're going to need to figure out with the board and with the community about how we adjust to the upcoming landscape. I can't speculate specifically on what will happen, but I will say that, for us to be able to maintain a system of absolutely essential care for people who need it most, it's going to be a real challenge, and we need to work together more than ever before to get through this time. And I'm optimistic because Contra Costa has that history of leadership and support for health and health equity. And I say I'm not going to sugarcoat it. This is going to be a really challenging time, and we're going to need to work together more than ever to figure out what this looks like going forward.
Thank you, Dr. Colfax. That's a good note to end on. I want to note for folks who have never looked back at a Board of Supervisors meeting video, there are videos available on, if you Google Contra Costa Board of Supervisors Agenda Center, then there's a chart, you can find the date and sort of navigate. It's fairly straightforward if you want to look at the video or see the materials. Dr. Colfax, thank you so much for joining us. Appreciate what you're doing and leading the department, and appreciate you being here to speak to our community today. So thank you.
Thank you.
All right, let's try to do, if we can get the slides back up, please. By the way, I just want to introduce Trinity Gully in the background. She's part of our Ensuring Opportunity and Budget Justice Coalition team, and they're an amazing talent at running slides and making all the things happen behind the scenes. So thank you, Trinity. All right, let's go to I think the slide before that. There we go, because we're going to meet the rest of our speakers tonight. And so we heard from Dr. Colfax, and then we have three amazing leaders in our county who are going to now broaden the conversation. And we are going to start, as Rachel or Sarah said in the beginning, we're going to start with some questions that we have come up with, we, the planning team, based on questions received from you when you registered, and our own questions and questions we've heard out in the community. So it'll be a broader discussion now. And then after we have those moderated questions, then we will open it up to all of you to ask questions of our three panelists here. So let me introduce them. Supervisor John Gioia is the son of a former high school civics teacher, grew up in Richmond, and was first elected to the Board of Supervisors in 1998 after working as a lawyer. Much of his work focuses on achieving environmental justice and equity, more opportunities for youth, greater access to healthcare, attracting green energy jobs, and protections for our immigrant community. He is a recognized Bay Area leader on improving air quality, addressing sea level rise, and improving San Francisco Bay. Welcome and thank you, John. And next we have Dr. Sarah McNeil. She is a family doctor who came from the East Coast to Contra Costa in 2009 to train at our own county hospital here, because this health system, she says, is known throughout the country as being one of the most committed to serving vulnerable patients. For the past 17 years, she has worked in multiple areas of the hospital and clinic systems, including primary care, the residency, labor and delivery, and healthcare for the homeless, to name just a few. She's currently the medical staff president of the Contra Costa Regional Medical Center Hospital and Clinics. And then last but not least, we have Josh Anijar. He was born in Florida, but raised all around the country, primarily living in the South and West. After graduating from Arizona State and receiving a master's degree in labor studies at University of Massachusetts at Amherst. In 2019, Josh became the executive director of the Contra Costa Labor Council, a federation of 92 unions representing 90,000 union members. He's a member of IATSC Local 122 and IBT Local 665. And Josh Anijar lives with his wife in Contra Costa and enjoys spending his time nerding out on music and science fiction. So welcome to our panelists, and glad you're here. And as I said, we're going to start with a series of questions that I will ask, and I'm going to tee it off with this question. And Dr. McNeil, let's go to the first question, please. Yeah, thank you, the Trinity. We'll start with you and then we'll open it up to everybody else. So this first question is just a broad question to kind of get us all in the conversation. So Dr. McNeil, based on your role and perspective at the hospital and clinic, describe the landscape our county and its residents will be navigating in the coming years. So Dr. Colfax has sort of laid out, and Rachel Rose kind of before him did as well. What is your take, or what do you want folks to know right now about what's going on from your perspective in the hospital and clinic system in Contra Costa?
Thanks so much for having me. I'm so grateful to be here amongst amazing leaders in the community. I think that, like all of you, as we fill up our gas tanks, these times are hard, right? Like we are in a crisis for everybody. And for the patients that I take care of at Contra Costa, the unhoused and those on Medi-Cal and Medicare, navigating the health system starting in January just got that much harder. It is a real crisis of accessing healthcare that people need. And It's hard and it's scary. And in the many roles that I have, I feel really grateful that that I serve in Contra Costa County because the support from people like you and the community members and making sure that we will continue to keep the hospital and clinic doors open is really the ray of hope in a really bleak landscape for the most vulnerable patients accessing basic healthcare that we all think that they need and deserve.
Thank you so much, Doctor. Supervisor Gioia, anything to add to that in terms of this current landscape that we're facing?
Sure. First, I want to thank all those who are participating because I recognize a lot of you as being active members of our county community, whether it's in business or labor or nonprofit. And it's our collective work together, and I think that makes our county strong. So I just want to thank you for that. I have served on the board for some time now, and these are clearly the most challenging, uncertain times for our health system in the time I've served on the board. Um, we provide medical care through our county system directly to nearly a quarter of our county's residents, over 260,000 people, just medical care, not the other human services we provide. And the landscape for us that you heard about of uncertainty is not just about what will challenge our capacity to keep people on healthcare, but you heard a question regarding basic healthcare. The county, under state law, under Welfare and Institutions Code, Section 17,000, is responsible for providing indigent healthcare. These are residents of our county. We have something called basic healthcare, and this was asked in a question. So yes, these sales tax funds can be used to provide direct healthcare services to people who may fall off of Medi-Cal and then enroll in the county's own indigent care program as required under state law. And let me make a really important distinction here. The better job we do, and we'll talk about this in another question, the better job we do to keep people on Medi-Cal, which is paid by federal and state dollars, the less we will incur in spending county dollars, property taxpayer dollars, in providing health care to people who fall off these federal and state funded programs. So I think it's important to remember that, and don't take my word for it, that the goal here when the board placed this on the ballot was to protect the health and economy of our residents. And that is why both the Hospital Council of Northern California, which is made up of the health systems like Kaiser, Sutter, John Muir, understand the impacts of these cuts and why they are endorsing this revenue measure. Second, the largest group of employers in this county, the East Bay Leadership Council, which is made up from small businesses to oil refineries and everything in between, and banks and service providers, retailers, has also supported this measure because they understand the impact on our economy. And I just want to say, not to trust my own words, that Mark Orcup, the president and CEO of the largest business group in the East Bay, said, "A strong economy depends on a healthy community. If people can't get care, they miss work, businesses lose productivity, and costs escalate fast. That's a hit on that our local economy can't afford." So, from the standpoint of challenges, we're doing this to protect the health and economy of our county.
All right, thank you, Supervisor. Josh, over to you. And I'm going to start combining a few questions because I want to make sure we get to the juicy ones. So in addition to this one about describing the landscape, is there anything you'd add? And then the Trinity, if you go to the next slide, we'll just introduce the second question. Why do we need this measure? I think a lot's been already said, but please add your labor and life experience to that question as well.
Hey everybody, I hope you're all having a good night and rested somewhere awesome as we're doing this in cyberspace. Look, at the Labor Council, we believe that everybody has the right to healthcare and that healthcare, we fight for single payer. I'm just saying that now, Medi-Cal, all those things to make sure that all workers should be able to go see a doctor. When someone is sick and they prolong receiving healthcare, the health impacts are that much greater to them, their community, their loved ones. And we want to make sure that everybody, regardless of income, are able to get things like dialysis treatment or have insulin and not have to ration care. We saw what happened to working people prior to the ACA, where I knew friends that were like rationing how much insulin they actually could. They could because they couldn't afford it. And we live in what is the wealthiest country in the world, and somehow it's really expensive to be poor. It's really and the health detriments that workers face. To what Supervisor Gioia just said that East Bay leadership talked about. Like we want to make sure that workers are going to work healthy, that they can go back to their families safely, and that if something, a medical emergency happens, there is something. If we lose the county hospital, this impacts all workers that have healthcare already that are seeing either at Kaiser or John Muir or other places. We want to make sure that we have a county hospital that everyone can get care regardless of their income levels and so forth and receive basic care. We're a society. We want to make sure that everybody is healthy and has an opportunity to thrive, and that something that's either curable or treatable or needs stuff that they can get to them. I think that's what this is about. We want to make sure that every worker is whole in Contra Costa County, that every worker has basic health care, and that a medical emergency. Most workers can't, and this is prior to where we are right now with affordability. Most workers could not afford a $400 emergency right now. If their tire blows out or something like that, they're in an economic hurt. We need to make sure that medical emergencies don't lead to more bankruptcies, more houses under stress, and more people rationing basic health care in the 21st century. It just seems kind of backwards. So that's why the Labor Council and unions are for this. Most union members have healthcare. We want to make sure that everybody has this. All workers have the ability to go to a doctor and receive care. And also, we want to make sure that the people that give care also have, the resources they need, which is an insanely hard job to administer care, whether doctor or nurse or you just work in a hospital. And we want to make sure that they have the resources they need to really affect change for all the patients that are coming into the hospital. So that's why we need this. I think I kind of tied it into all of this of why we need this as well, why we're caring about it, and what sort of this larger, almost existential threat for Contra Costa's public health system as a whole.
Great. Thank you so much, Josh. And then to our panelists, I'm going to do a little combining of question 3 and 4, just so you're prepared. So I'm going to start with you, Supervisor Gioia. So this does get to the the Board of Supervisors level of decision making. So what specifically will the sales tax measure revenues be invested in? How will they protect residents most at risk of harm? And how will you prioritize funding allocations with so many competing and worthwhile needs?
Good question. This is a general measure. However, the ballot language does state the priorities for the measure, which is really about backfilling the federal cuts in health and human services. You heard from our health officer. We have gotten regular updates and will continue to get regular updates on how the federal policy changes and financial cutbacks will affect our system. What the board has said is we want to prioritize funding in a couple of ways. First and foremost, maintaining the infrastructure to keep people enrolled in Medi-Cal because that is at federal and state cost. The requirements of the federal law require people to now re-enroll every 6 months instead of every year, and also place other requirements, including work requirement. So the workload of our eligibility workers and the infrastructure in our Employment and Human Services Department has doubled. And in order to be able to keep people enrolled, we need to increase that infrastructure and our partnerships with community-based organizations so that we keep people enrolled. Second, we know there will be people who drop off. So we will use funding to provide health care. This is what the board has said. Obviously, we're going to evaluate all this once everything happens. But we've talked about keeping people in some sort of healthcare, and it's our basic healthcare program. And it is expensive to provide healthcare directly and medical services directly under state law. We are obligated to provide that. So that will come at county cost. So some of the funds will be used to directly provide health care to people who fall off of the federal and state funded programs. We will also use it for food assistance. A lot of the requirements on enrolling in food assistance, what's called SNAP or CalFresh, are also more difficult, and our same eligibility workers who enroll people in Medi-Cal also do the work to enroll people in food assistance. We have seen an unprecedented demand on our food security system, the food bank in this county, all the wonderful nonprofits that are providing food assistance are seeing already an increase in demand. So we would be providing funding to keep that infrastructure and benefits. We also will be getting cutbacks in the way our health system, our county clinics, we have 11 clinics around the county, and our hospital for funding of those systems. We want to maintain the same level or as much as possible of services, because if we don't, people go to an emergency room. Look, I go to Kaiser Richmond. 50% of the people today who go to Kaiser Richmond's ER are not Kaiser members. Many of them are going there for emergency room care because they're not getting another type of care. That would just go up. That's again why the Hospital Council has supported this measure. So for those and more, this is a very fluid situation. We're going to look at how to be most cost effective, and we are establishing an oversight committee, which the ballot measure calls for that, an oversight committee of residents to ensure that the funding is being spent consistent with what we have said in the measure. And there will be also regular community-driven audits in addition to our own audits that we do as a county. So we're building in that public accountability, and any decision on how these funds are spent are going to occur through a public process where the public will have opportunity for input at a public meeting. We will be asking the director of our Employment and Human Services Department and our Health Department to provide us the most up-to-date information about where funding is needed most to keep people on healthcare and provide services. And I just want to add, we have been very prudent in how we spend money. That is why we have the highest bond rating in local government around in a AAA bond rating. So we are conscious, we're prudent, and we're going to spend the money as effectively as we can with public input.
Thank you, Supervisor. Dr. McNeil and Josh, is there anything you'd like to add to what the supervisor just shared? Nope. Okay, we're going to move on. We're doing well on time, y'all. Okay, so next question. Let's see. And Supervisor Gioia, you sort of answered one of the questions, but before we get to the other part of that question, let me ask this one. I'm going to start with Josh. So Josh, and also then Dr. McNeil, I'll cue you up after him if you have something to add. So this question is question number 5. How would you explain this tax to a Contra Costa resident who is already struggling to make ends meet amid rising costs of living? And we've all heard this one a lot because we want to help our communities, and yet we're trying to fill up our gas tanks. So Josh, how would you,
Totally.
yeah, what would you say?
Yeah, I mean, they're right. It is very hard right now for residents and for everybody to try to, I wish we could just tax the billionaires right now for this and not put more burden on the working people. But with any crisis, with any time where we are faced with something like this, I'm always amazed at the resilience of community to come together to solve big problems. And that's what we all have to do right now. We want to make sure our neighbors, our loved ones, everyone can go see a doctor, can get food assistance if they need it. And if we all do a little bit, if we all are able to invest in ourselves, invest in our local government in a way that actually produces good outcomes, better life expectancy, better communities as a whole that are safe and healthy, then that's something worth investing in. And so many times we're sort of, the cost of everything is going up. Wages haven't increased for so many workers. And that's a large problem that we have to address as a society. We really have to reward working people more and give them higher wages, better benefits, and all of this. But as we fight that larger struggle, we need to make sure that Contra Costa is kept whole and that we actually have, it's amazing to have a county hospital. And if we lose it, it's near impossible to get something like that back. So for all of us, if we all can give a little so that everybody is safe, that's what society is about. That's sort of the social contract. And I hope that residents understand that and will respond by passing Measure B to make sure that we have a hospital, that we have food assistance for those that need it, and that our county continues to provide services to make sure that everyone can both dream, live, and have, bread and roses, something that we fight for. That's what we're going for here. So that's my sort of elevator spiel. If I was with someone and they had that question for me, that's what I would say to them.
Thank you so much, Josh. And Dr. McNeil, is there anything you'd like to add to that?
I don't think so. I'm trained in healthcare.
Mhm.
I defer to, I defer to the Board of Supervisors and Supervisor Gioia and the work. These are really tough questions to answer.
Mhm.
I'll briefly add,
Mhm.
look, I'm very conscious, and I think the board was very conscious about this, understanding that sales taxes are in the neighborhood of around 10%, and we understand that challenge. So a couple of points. One is this was designed as a temporary 5-year tax. It ends in 5 years. It is not the only thing we are doing to solve this issue. We are working internally to look at how we make whatever cuts we need to make, and we've already started doing that. Two, we are working with the state. Counties in California have requested the state to help us with some of these costs. We don't know if they're going to do that. And third, we are continuing to advocate for federal policy changes, which aren't going to happen at a minimum until there's a new administration in Washington, which is going to be after 2029. And then it takes a couple of years for policy changes to really go in effect and turn things around. This is why we are planning this as a 5-year measure, knowing that we think there will be such harm from these cuts that we're going to see, hopefully, changes within 5 years. I will say, so what would people pay at a 5/8 cent sales tax? Let me emphasize, the hardest hit folks here are going to be our most vulnerable lower income residents and seniors. We've done a little analysis. The average resident earning average median income, who is less likely going to be impacted by these cuts, may pay $8 to $10 more per month in sales taxes based on their spending. That's average. The lower income residents and vulnerable seniors spend a lot less and will pay probably under $5 a month more. But if this doesn't pass and people lose health care and food assistance, don't be fooled. They're going to be paying a lot more than $5 a month in food cost or potentially other cost incurred to their medical care. So the most vulnerable who will be hardest hit will be paying under $5 a month extra in sales tax. We understand every dollar is a challenge, but when the option is you're going to be spending a lot more for food or for care, that this is a good investment for those who are an important part of our community, with potentially up to 90,000 people losing healthcare. Think of the effect that has on the economy, as well as the healthcare system. When people get healthcare in an emergency room, that raises the cost of healthcare for everyone, which is reflected through our insurance rates. Um, that is why the hospital council supports it. They know the effect on them and the healthcare system. So I think we believe that this is, even in the toughest times, a reasonable investment that pays far more benefits than the cost and goes away in 5 years.
Thank you, Supervisor. And Dr. McNeil, I see your hand is raised. Go ahead.
Sorry, I'm having a technical malfunctions. I also just wanted to say that, you know, it's not the supervisors directly talking to us and the healthcare system, but definitely Dr. Colfax, you know, on a weekly basis. And then there doesn't go a meeting by where we aren't also talking about how to make sure that we are cutting costs, decrease admin time, making the health center more efficient, making sure that we are increasing access for the people that we can see, thinking about how we can revenue generate. So it really, I think that this is one piece of many, many, many things that are continuously happening because we are all really worried about this moment of crisis.
Yeah, thank you, Doctor. We're going to move on to question 7. Eternity, if we can jump there. Oh, great, thank you. So the question will start with Supervisor Gioia, and you alluded to it a bit, but let's expand. The question is, and again, it comes up a lot, what happens after the sales tax expires in 5 years?
Well, 5 years would take us through 2031, and I always try to be an optimist. I believe that this country will see the impacts and will work to turn these policies around. Look, I serve on the executive committee of the California State Association of Counties. I get to work with county supervisors around the state and around the country who are Republicans, independents, and Democrats. And many of those supervisors who are Republicans and independents also don't want to see these cuts in their rural counties. Glenn County, a very red Republican county, saw its only hospital close. I can tell you the Republican supervisors in that county were not happy. I think, I believe that as these cuts affect real people in real time, we will begin to see momentum to turn these around. And that is why we're looking at a 5 year to give time for us, as Dr. McNeil mentioned, to do the cuts we can make as much as possible. But have no doubt that if this measure does not pass, thousands or tens of thousands of people will lose health care. Our emergency rooms will have more activity, and people will be stretched further. It's possible that our clinic hours and range of services are decreased. Um, and we are going to see people get sicker and the cost to our healthcare system go up. Look, we do have reserves. We've been very prudent that we can draw on some of our one-time reserves. They are not enough to cover us for the 5 years by any means. And I want to address that because someone said, why don't you just draw down reserves? Well, um, we spending one-time money for what's an ongoing issue, if this measure doesn't pass, will draw down reserves. It will then affect our bond rating, which will increase the cost. We own lots of buildings of the capital work that we do on our buildings, so that comes with an increased cost. Um, and just the basic dynamic that one-time reserves aren't enough to patch what is a multi-year problem in our healthcare system. So people will get sicker, and we will end up having to reduce services. How much will depend upon, I don't want to predict the future, but will depend how much in terms of cuts will depend on whether the state's able to step in with any funding. They have, so they have indicated any help's going to be short term or one time. So it is not a good situation for tens of thousands of our county residents.
Thank you, Supervisor. And we are getting to the time that we're going to open up to audience questions. I'm going to start with a couple that I see in the chat, and we'll try to get to every question. So I'd ask our panelists to continue doing a good, concise job of responding to questions, knowing we have 14 precious minutes left in our time together. So the first question that I'll ask from the chat is posed by Tracy Kasamoto. It's a pretty detailed question. Supervisor Gioia, I think I'll direct it to you. It's talking about the stated $307 million deficit, which may have been misstated at a board meeting. I'm not sure, although I was at that board meeting. And then Greg Colley down below was saying that had been clarified. So without going into like all the details, can you just sort of talk about the deficit and just have the publicly correct information for all of us to know?
All of that is out, all the current information and accurate information is out in the public record. There was a minor correction from a previous meeting from last year into this year. Since that time, the bottom line is, under all estimates, as publicly disclosed that are accurate, we will face over 5 years a $1 billion deficit. 1 billion. I understand that there are people who philosophically are against this, and I respect that there's different points of view. But this comes down to uh, whether or not we have funding to keep thousands of people on health care. Um, Look, uh, this measure is not going to raise everything we need, which is why we're also looking at the cuts we need to make, which is also why we're doing request of the state. Even with this measure, even with spending some one-time funds, this is a problem that will go on for 5 years. And if people want to say, well, county, let these people fall off of healthcare, try to solve it with one-time money. My value system is we need to plan ahead. We need to ensure that we have funding to keep people enrolled. And every analysis we have publicly done that's out there, that the public understands before they vote is accurate. So the last presentation at the budget, everything is out there, everything is accurate, and it's before people have a chance to vote and they're getting ballots now.
Thank you, Supervisor. The next question comes from Debbie Toth. It's directed to Dr. McNeil. Do you have access to the actual costs you need to understand how to create these efficiencies and cost savings?
One of the reasons why I opted to be medical staff president, which is a job that nobody else is really, very few people are willing to do, is because I don't deal with any of the economic aspects of the hospital. I go to work and I take good care of patients. So I defer that to the supervisors and the joint conference committee, and Dr. Colfax and the CEO of the hospital. So I am going to kind of punt that one, Debbie. Sorry.
Thank you. Next question is going to go to Josh. Again, questions from the chat. Why does Diana Canturena is asking, why does the burden of this collapsing healthcare system continue to fall on everyday hardworking people, especially when the money doesn't go to new creative models of healthcare, like a hyper-local single payer system, preventative medicine, and food as medicine?
Yeah, I can't speak to the specifics of like food as medicine stuff and all that. I'm not like Dr. McNeil. I'm not a medical practitioner. So, but what's up? Like, it's always good to explore all, empirically data-driven stuff. So for your question in terms of why aren't we exploring new avenues or thinking through different forms of healthcare? We are, but in order to do something like that, at least I can speak for the labor movement, it's got to be at either a statewide level or something so big that we have a large enough insurance pool that can, carry us all. That's why we fight for Medi-Cal at the state level to make sure that we hopefully have a single payer system where healthcare is a basic right as an American or as a Californian at least, so that you can go see a doctor. What I'm concerned about right now is losing what we have right now is dialysis patients not being able to go to their clinics. It is preventative care to make sure that something that's small doesn't result into like catastrophic unreversible damage. Like we have to protect the safety net that we have as a foundation to dream of how do we ensure more people? How do we make sure that everyone has access to quality healthcare? So like let's get this foundation, make sure this is because if this falls, like even the ideas of single payer or making expanding healthcare becomes that much harder to attain. So for me, it's about this is a foundation to keep what we have to make sure that those that are needing basic healthcare can access it and that all of our premiums that we pay right now don't continue to escalate even higher because we lose that larger safety net.
Right.
And then I can nerd out with you all day about how we need to fight for better healthcare, how we need to have better access, and that everyone, regardless if they live in a city or in a rural community or wherever, can get quality healthcare. So I'm totally for that. I would love to explore all avenues of that. But before we can dream, we've got to also like make sure that we have a good foundation in the county to provide all working people with basic healthcare.
And like I say, Josh is exactly correct. And that can be the subject of a whole separate town hall because, the reality is we have to deal with what's in front of us. We have to have parallel tracks, take care of our residents under the system that is in place today while we advocate for a more fair, equitable system. Look at Medi-Cal already, their reimbursement rates are less than the cost of providing service. That's why urban hospitals around this state or around this country often are failing, where they don't have a payer mix of other insured patients outside of Medi-Cal. So think of it. When you have a system that's paying doctors and the healthcare system less than the cost of providing service, you're going to challenge the system. I'm proud that in Contra Costa, our county health plan was the very first county health plan in this country that was approved for Medicare reimbursements back in the 1980s. In a way, we are like a Kaiser system. Um, the 260,000 people who are enrolled in our system and insurance system that get medical coverage through our system, our physicians, their job, they do a great job of trying to keep people out of the hospital. Their primary care and any specialty care is designed to keep people well so they don't get sicker and have to go to the hospital because it's a lot more expensive serving people in the hospital than it is in an outpatient setting. So that's similar to the Kaiser system. And when you have low reimbursement rates, it becomes even more challenging. And we need to be advocating for fair Medi-Cal reimbursement rates because many hospitals, not just around here, have closed because of that. And that's unfair. It's unfair to middle class communities. And let me just say, the overwhelming majority of people who are covered by our plan who get Medi-Cal are working families. These aren't, there's some unemployed, but most are working families whose income is not high enough to get other insurance. So that's the challenge we face. And to add on top of it, and I've already heard stories, because the federal government cut subsidies to those enrolled through the Affordable Care Act or Obamacare, Middle class families are dropping healthcare and they're going to go to the emergency room more because the federal subsidies that have been in effect have gone away. So this administration in Washington is taking away healthcare not just from lower income Americans, but from middle class Americans.
Thank you, Supervisor. And we're going to go to Dr. McNeil next, and we'll ask one, perhaps two more questions. Want to say just real quick, if you did not get your question answered tonight, we'll collect and send follow-up questions to all the panelists and ask them to respond, and we'll share that with everyone. So if you have a question and you thought you might raise your hand, please put it in the chat and we will promise to follow up. All right, Dr. McNeil.
I totally agree with the point that healthcare is not working for so many people. And I think Contra Costa, having worked in other systems and coming across the country because this county system is so well known, is a really unique and wonderful place. In a sense, we are doing, like the Kaiser model, we are doing a type of single payer plus healthcare. I pay into Contra Costa health plan as a patient because I want to get my care where I am also providing care. And I help to subsidize the program because it's really important to me ethically to be part of the system. So I think that we are doing creative things like that, and we totally need to do better. We are not serving the patients as well as we could. And I show up to work every single day to really try and continue to do better. We have recently tried to build out our community advisory board. And so if any of you on the call, many of you are included, but I just feel so compelled to put in a plug that we would love to include you in the work that we are doing through the medical staff to improve patient care, because for sure, all of your ideas and input and how to serve the patients is ultimately why we all come to work every day and want to keep on doing better.
Thank you so much, Doctor. And I think this will be our final question. I'm going to direct it to Supervisor Gioia from Rachel in the chat. So Supervisor, you mentioned establishing a formal community oversight process. Can you please share more about what that would look like and how community members would have a seat at the table to share their priorities and their lived experience?
So the ballot measure calls for an appointed oversight committee along in addition with annual audits. What I would propose is that when the board discusses this, that we have a broad cross section of residents across this county who, especially those who may be impacted, folks from, across geographic representation from all the communities we serve, from those who are on Medi-Cal to those who are not on Medi-Cal. We want to cover everybody. And the idea is, look, our health department and our employment human services department will provide data to all of us about where the needs are greatest so we could make decisions on an informed basis that most cost effectively uses this money. And will we also hear from those with lived experience? Look, we have good data. We have our own medical staff like Dr. McNeil and our whole team who give us their experiences, and we will hear from community through that. We haven't decided how many will be on this. I think that's a good point for discussion. It should be broad enough to include the broad spectrum of our county. Let me be clear. There are people, organizations who may take a position against this measure. The last time I checked, they don't represent the broad stakeholder and diversity of our county, and we need that diversity represented when we get input about how the money is spent.
Thank you, Supervisor. And we are just about out of time, so I'm going to turn it over to my colleague Sarah Gurdian to help close out and talk about what comes next.
Awesome. Well, thank you all for joining us in this wonderful conversation and for staying engaged. We want to make sure that we keep our promise in terms of just sharing information with you all. And again, we truly appreciate your time, your engagement, and commitment to staying informed and involved in what's happening across our county. And again, thank you to all of our panelists for making the time to answer all of these questions. I know it's a very challenging conversations and a tricky time that we are all in. And so thankful for you all and of course all of the attendees for asking your questions. If you're interested in diving a little deeper, we encourage you to review the April budget hearing materials using the shared drive link that we will be pasting into our chat just shortly. And in this shareable drive link, there are presentations from the Contra Costa Health and the Employment and Human Services departments on key data and updates. This is to help provide you with a fuller picture. We will also be sharing a recording of today's webinar with all of the participants in a follow-up email. And I also want to know, I don't think the video recording of the April budget hearings are available yet, and I'm thinking they will probably be published in the next few weeks or so, in the next week or so. So just wanted to point that out. But thank you again for all of you being here. And again, we look forward to continuing this work together. And thank you to all of our attendees for making the time this evening.
And thank you to our interpretation team as well.
Everybody.
And our wonderful interpretation team for being in the room.
Thanks. Thanks, everybody.
Thank you.
Bye,
Thank you
all.
all.
Safe,
And
everyone. Bye.
Mariana, thank you so much for your moderating this.
Of course.
Agreed. Yes. Thank you to our moderators and our co-hosts. Bye, everyone.